Hey folks, thanks for joining. I see it's just hit 1, so we want to get started right on time. Thanks everybody for joining us today. Welcome to our session, which is called Health Literate Website Redesign, Set Yourself Up for Success. We are so excited to be here with you all virtually. Sorry we couldn't be with you in person. My name is Emily Brostek. I'm a Senior Content Manager at Communicate Health, which is a consulting company that's focused on making health information easier to understand and access. And I'm joined today by my colleague, Kim.
Hello, everyone. My name is Kim Hassel. I'm a Senior Health Communication Manager, also at Communicate Health. Emily and I have worked together on some big website redesigns, and we're really excited to be here, like Emily said, and share some lessons learned and best practices with you all.
All right, so today we're going to talk about how you can use a few strategies to set yourself up for success when you're redesigning a website. More specifically, we're going to talk about how to identify and involve your users in your site redesign, how to set goals for your website, how to create a content strategy that prioritizes health literacy, and how to practice inclusive design. Before we jump in, I'd like to acknowledge that we will not be talking about every aspect of a web redesign. After all, we only have about 50 minutes together, and there's a lot of things involved with redesigning a website. And also, Kim and I are not web developers, we're not designers, so we won't be getting into the more nitty-gritty technical details. Instead, what we'll be focusing on is the strategies that you can use as health communicators to design a health literate website. We also want to hear from you. We tried to make this session as engaging as possible with some discussion questions and activities. So we hope you'll use the Q&A feature on your Zoom to chat us your thoughts and questions when we pause for reflection or discussion. We'll also make sure that we save some time for Q&A at the end, so feel free to kind of chat questions as we go. I also want to note you're all on mute for this session, so the Q&A feature is really the way for us to hear from each other. Now, before we dive into the meat of this presentation and start talking about strategies, let's start by talking about the challenge we face with health information online. Now, the fact is that we all struggle with complex health information. And that's because there are some things that make health information unique. Health information is personal, but it's also extremely complex. And when we seek out health information, we're often in a situation where we are feeling stressed or anxiety because of our own health or the health of someone that we're caring for. So a couple common scenarios that you might be able to imagine, think about it's the middle of the night and you have a sick crying child, or imagine that you're in a doctor's office and you just got a cancer diagnosis. Or you can think about a situation we're all living through right now with this pandemic where health information is changing daily. These are all situations that affect how well you understand or don't understand health information. And we're all online, yet well over 80% of Americans go online, and over 70% of internet users seek out health information online. And 60% say that their most recent search had an impact on their health or the way that they care for somebody else. Yet only 42% of consumer health websites follow basic usability best practices. Now, as we know, many people struggle with literacy and even more people struggle with health literacy. So we have an opportunity here as health educators to design websites that all of our users can navigate and access, including users with limited literacy skills. And we know that it's not hopeless. Our research shows that limited literacy users can succeed if we design health websites with their needs and their abilities in mind. And in fact, all users benefit from improved usability. I won't get into the details of the study reflected on this slide, but as you can see, when designing a site that's intended for limited literacy users, all users actually succeeded more successfully at the tasks that they were trying to achieve. So it's really good for everybody. now that we've kind of set the stage, we're going to go over a few strategies that you can incorporate to ensure your website meets the needs of users with limited literacy skills. And I'm going to pass it over to Kim to go over our first strategy.
Thanks, Emily. So the first strategy we want to talk about today is identify and involve your users. So at Communicate Health, we work at the intersection of health literacy and human-centered design. And you may be asking yourself, well, what is human-centered design? So it's a creative approach to problem solving that starts with people and ends with new solutions. So essentially, you are working with the end user throughout the development of a product. So by the end, it's tailor-made to meet the needs of the user. And there's a couple different phases of the human-centered design process that I'll go over briefly. So with human-centered design, you want to start by learning about who your audience is, and then go to further define your target audience. And here you would understand, maybe some of their characteristics, their specific needs, their goals. And so that happens in the empathize and define phases. Once you have a better understanding of who your audience is, you'll then want to start to brainstorm some innovative solutions in the ideate phase. From there, you'll build a representation of your idea, otherwise known as a prototype, and then test with your audience to get their feedback. And depending on their feedback, you may need to actually go back to the ideate phase. And so the point here is that it's not a straight line, it's an iterative process. And you may, be going to different phases throughout the process of building a product, depending on the feedback that you're getting. And within each phase that I just went over quickly, there are a lot of different methods that you can use. And the point is not to use them all, but it's dependent upon your resources and time available. So I won't go through all of them, but just wanted to give you a high-level overview of the types of methods that you could use. With the emphasize phase, so like I said, you want to get to know who your audience is. So the questions here that you'll be asking or trying to answer are much more broad. And so you may be talking to lots of different people. So maybe you're doing some focus groups or some interviews, or maybe you're sending out a survey. And then the methods under define help you narrow down that audience and get to know them better. So from there, you're able to construct a better picture of who they are and their characteristics. And then the questions that you're answering from here get more specific in each phase, right? And they answer different kinds of questions. And so for each phase, you're trying to figure out something different, and there's a different technique in order to do that for each phase. And like I said, you can't do all these methods. Most of us don't have unlimited budgets, unfortunately, but the goal here is really to get the product in front of users as many points as possible, so you can get the feedback that you need to further iterate. So, why do we do human-centered design? Why do we follow this process? Well, it really helps to ensure that your product will be usable, or the ease of use. Does it work? Can a user get from A to B? How easily can they accomplish the task at hand? You want your website to be useful, or the level of value that the website brings to the user. Do they find it helpful? Is this what the user was expecting when they came to your site? You want your website to be appropriate. So does the design match the user's skills and experience? Is it easy for them to understand? Is it accessible to them? Is it culturally relevant to them? And finally, you want your website to be appealing. So is it attractive? Do people want to interact with it? But, like I mentioned before, we often don't have unlimited resources and time to work on these products. So, we usually have constraints with our work, but what we want to start here, we want to start with the human element. And that's what we were talking about with human-centered design. It's, is your website being built with the end user in mind, with their feedback? So you want to start there with that human element, and then kind of work within the limitations that you may have with your company. Maybe there are budget limitations, timing, and then, within the technology that's available to you as well. But there's always a balance. And so as health communicators, it's our job to find that sweet spot that kind of merges all three, but starting with that human element. So far we've talked about the human-centered design process, and now we're going to talk a little bit more about planning and goal setting and how it's connected to human-centered design. So once you understand who your audience is and what their needs are, you can then begin to plan and start to set goals for your website. So the first step here is to establish goals or long-term outcomes about what you're trying to achieve for your website. These goals may be tied to a larger communication, outreach, or digital strategy, and it's okay for them to be broad or unstructured, but these goals should align with what you discovered about who your audience is and what their needs are. Next, you'd want to break down your goals into measurable chunks called objectives, so you can assess progress towards your goals. And you want to be doing this at the beginning and then track and report, but you can kind of think of goals and objectives as this. So you can think of the goal as the vision, the big thing that you're working towards, and then the objective is how you're going to get there. So we have an example here of kind of putting this into practice, but Emily and I had worked on a website redesign for one of our clients, the National Eye Institute, as part of the National Institutes of Health. And one of our overarching goals for this web redesign was to ensure that their web content is clear and meets users' needs. And an objective that we used to kind of track and measure how we're going to meet that goal was to ensure that any new or revised web content scores 80% or higher on the CDC Clear Communication Index. We also wanted to share some pro tips that we have gathered along the way, because we are talking about redesigning a website, but the goals and objectives will differ based on where you are in the build. Perhaps you're building a new website, or maybe you are just redesigning a current one. So for a new website, you'll want to be setting some big picture goals for how to reach and engage your priority audiences. And for a web redesign, what we've been talking about, you'll be developing goals and objectives that focus on those broad measures of success, as well as some key areas for improvement on the website. So as Emily said, we wanted to try to make this interactive for folks. So we'd like to pause and hear from you. What are your users trying to accomplish when they go to your site? And if you could chat us in the Q&A function, we'd love to hear from you. And while you're reflecting, I can give some more examples from the National Eye Institute. So what we had learned from our formative research was that researchers were looking for NEI-funded grants. We also learned that folks are looking for eye health information. So maybe a patient was trying to find information about an eye disease they'd just been diagnosed with. So these were some tasks that were specific to us. And so I'm seeing here in the chat, and I don't think that you guys can see this, so I'll just kind of reiterate what folks are talking about, but some folks are saying training opportunities. Folks are looking for resources on their website, about looking for medications and devices. So these are some great tasks. And the idea here is that you are designing your website knowing what your users' mental models are and what they're trying to accomplish, and setting up your website in a way that matches their mental model and makes it so like these key features are easy for them to find and they can find it quickly. So thank you for chatting us and participating. We really appreciate it. And at this point, I'm going to turn it back to Emily, and she's going to talk about a second strategy.
Thanks, Kim. All right. So in this next section, we are going to talk about how you can create a content strategy for your site that prioritizes health literacy. So to start, what is content strategy exactly? Content strategy is planning for the creation, delivery, and governance. And here, governance means taking care of your content after your site is live. So you're planning for the creation, delivery, and governance of useful, usable content on your website. Essentially, what you're doing is you're planning for the entire life cycle of content on your website, You're not just planning for redesign and launch and what's on the site at launch, but thinking through what happens after launch. How do we keep this up to date? How do we make sure this website is as good as possible over time and keep up our standards for our content? And I'll also just emphasize, you really do need to do this first. You really should be leading with a content strategy. You know, if you're following human-centered design, you're, you know, learning things about your audience and what they're trying to accomplish on your website. But, you know, we hear from people sometimes who think they can create a new design for their site and then worry about the content later. And we would encourage you to really lead with content and start with a content strategy that then guides everything else that you do. Now, there's a couple key components of creating a content strategy for your redesign. And we're going to go into each of those things. So first, you need to understand what content do you have now? And then you need to come up with a game plan for what you want to achieve. And that includes how content is going to be organized on your redesign site. And then you document all of the decisions you've made about your site and your content strategy in a content strategy document. Each step here is informed by your users, as Kim just discussed, and that includes research to understand who your audience is and testing along the way to confirm your content strategy and the decisions you've made. So let's talk a little bit more about each of these steps. The first step is really to understand what content you currently have, and we do that by doing something called a content audit. A content audit is literally typically a huge spreadsheet that tells you basically what content you have now. It also tells you who that content is for and whether that content is useful. You can kind of think of a website redesign as like moving to a new house. And just like when you move, you might start going through your things and your junk drawers and figuring out like, what do I have? What do I really need? Is this really useful to bring to my new house? A website redesign is a good idea. It's a good time to do that with your content, and your content audit will help you do that. Oops. And a content audit typically includes quantitative criteria. So as I said, it's usually on a spreadsheet that lists all of the web pages or assets that are on your site, as well as their URLs and page titles, and the date that each page was or piece of content was last updated. And it usually includes some qualitative criteria as well. So this is a good opportunity to assess whether your content follows health literacy best practices. So is your content written in plain language? Is it easy to scan? Are you putting the most important information that a user needs to know at the top of your page where they can see it easily? You can also check for things like, is the voice on your site consistent? Is your content up to date? Is your content aligned with your organization's current priorities? And based on this information, you know, once you kind of assess what you've learned, you'll probably realize that some content needs to be updated. And you'll also potentially find that there's content that can be archived or removed. You know, part of the purpose of doing a content audit is seeing all those old pages that you forgot you had and there's no longer a purpose for. So we often use a couple different tools when we do a content audit. One is the CDC Clear Communication Index, which Kim also mentioned. Also the Health Literacy Online Checklist. Those are two evidence-based tools that can help you really see whether you are following best practices for content and web design. You may also have some internal tools that you use. For example, at CH, we have a usability audit, you know, that we've developed internally. And you might have other things that you want to develop and check for based on your own organization's priorities. So now that you have assessed your existing content, and if you're using human-centered design, you've also learned along the way about your audience and brainstormed some innovative solutions. At this point, you're ready to come up with a game plan for the content on your new site and document that game plan in a content strategy document. This is a living document that you create and then update as the website redesign evolves, but it's basically where you put your decisions so that you can get your team on the same page. So a content strategy document typically includes things like the purpose of your site and your goals, the audiences for your site, the messages or calls to action that you have on your site, your voice and tone, your style guide, information about how your site will be structured. And here we're really talking about defining how content on the site will be organized, formatted, and displayed. And then you're also, as I mentioned before, thinking about what happens after the site is launched. So what is your workflow for creating new content, updating content, or removing content in the future? Who makes those decisions? Who's involved with those decisions? What is the process that you go through to do those things? And what's your content maintenance plan? Do you have a plan for regularly looking at the content on your site and making updates as needed? And also your content standards. If you're committed to writing in plain language on your site, this is where you would get that commitment down in writing, and also define exactly what that means and what that looks like, and how you assess whether you're meeting that standard. As Kim mentioned, for the NEI website, we use the CCI, the Clear Communication Index, as a way to make sure that we're meeting the standards that we've set for new content. Now, we're not going to have time to go over every component of a content strategy document. We could probably do a webinar on each of the bullets on the previous slide, quite honestly. But we thought it might be fun to pause for a moment and talk a little bit about voice and tone, which is an important component of your content strategy. So voice is the style or personality of the writing on your site. Voice should be constant from page to page. So no matter where on your site a user is, the voice should be consistent. But tone is something that's flexible. Tone is the mood of your writing. Your goal for your site should be to keep voice consistent throughout your site while matching tone to the content and the user's emotional state. And let's take a look at exactly what that looks like. So on this slide, you can see a couple examples. Let's say in this example that you work for a healthcare system and you work in the content for a patient portal. And the voice for your patient portal is conversational. You use a conversational voice in your communications. Now, you may have a friendly tone in messages like this first one, where you are just asking for additional details from a patient. But your tone when you are sending a message about a payment that hasn't come in, a payment that's late, you might take a more stern tone. You'll notice that both of these have a conversational voice. They're, it's not like a formal voice in one of them and a conversational voice in the other, but the tone has been adjusted to meet the situation and the emotional state that the user is likely to be in. And at this point, we would like to pause again for a quick activity. We're going to give you all a minute or two to go and take a look at your organization's website. So go poke around a couple sections, a couple pages, and think about how you would describe the voice of your site in just a couple words. So we're gonna pause and give you a few minutes to do that, and then we will check in with you at about, I guess, at 1:25, maybe a little sooner. Folks can start. You can chat in your responses to the Q&A as you identify where your voice is, and that'll give us a sense of when you're ready to chat too. All right, well, I'm seeing some good responses in here. I think, some folks are noticing that the voice on their site, is maybe not great. One person says that the voice on their site is formal and kind of jargony. Another person says not conversational, kind of along similar lines. The voice of our website, another person says, is passive and outdated. We need to make our voice more consistent and empowering to engage users. Yes, that would be an excellent goal to do during a redesign. Some other folks say that the voice on their site is conversational. Another person says friendly, personal, user-centered, which sounds great. Welcoming, super upbeat, inviting. And another person has noted, that they haven't really thought about what their voice is before. And so they're guessing that it's probably not super consistent. So, which is, I think not uncommon. I'll also just pause. I see we had one person, who noted, I know my example was with a patient portal, but noted that if you're using a system like MyChart that might have some kind of constraints in terms of the language that's already in there, that it might be a challenge to really control tone consistently. I think that's a great point. I will confess that I'm not an expert in MyChart or a lot of patient portal systems, but I think that goes back to Kim's point earlier that that you do have to work within the constraints of the technology you have. And as health communicators, we're trying to work at that intersection of, technology and the user and your budget. So just wanted to acknowledge that. Great. Well, thank you all for participating. Really appreciate that. Now let's move on to another important part of a site in any redesign that involves content and content strategy is creating a site navigation that is simple and intuitive for your users. So here we're talking about how you organize and label your content. This is your information architecture. You might also hear it referred to as an IA. So here on this slide, you can see an example of a nice clear site navigation. You might notice that the labels in the navigation up here, health topics, drugs and supplements, videos and tools, they're clear. You get a pretty good idea of what you're going to find in each category. But this site, Medline Plus, also gives users different ways to browse content. So you can see users can browse alphabetically with this A to Z list. They can also browse by body location, by disorders and conditions, or by demographic or population groups. So, depending on how a user is thinking of the content and how they want to interact with it, they have different ways to do that. Here's another example. Some things you might notice about this site. So again, there are some pretty clear top-level navigation labels. Again, users are able to browse topics A to Z to find what they are looking for. You'll notice that this site has also highlighted a couple health topics that users may be particularly interested in or that might be really popular so that users can navigate there really easily. So your goal with your site is to organize and label content according to your users' needs. You want to use labels that use terms that are familiar to users and reflect how they think of your content. So, which might be different than how you talk about your content internally. Again, this is where your audience research and user testing is really key. If you're following the human-centered design process, you should have a sense of what users are looking for on your site. You might be able to do an activity like card sorting that would help you figure out how they organize content, kind of what mental models that they have to think of your content. And you should also get a sense in that way of what terms are familiar to them. So at this point, and we'll see if this works, we're going to do a quick poll. Let's see. Hopefully you all see a poll. So suppose that you were looking on a website for information about asthma triggers, and the options here are links that you could click on. Which link would you click on to find the information that you're looking for? All right, I think a couple folks might still be voting, but I'm going to go ahead and end that poll. And hopefully you can see the results on the screen right now. I can see, so you see most of you selected asthma and allergies. And so this example on this slide, these three options are actually real examples from websites that have the information that you're looking for about asthma triggers. But if your user doesn't think air pollution and respiratory health when they are thinking asthma, then they might never click on that link and they might never get the information that you want them to get. Okay. So there's a couple tools that you can use to make decisions and kind of figure out how you're going to organize your content. Here on this slide, you can see an image. This is something that we used when we were redesigning the National Eye Institute site. We used an online tool that's called MindMeister, which is basically like a mind mapping tool that you can use to like map out where all the content would live, what labels you're going to use. You can easily move things around if you decide, you know, that the funding opportunities section actually belongs somewhere else. You can kind of move it around. So that's kind of a more technical solution you can use for this. You can also go real low tech and just put categories on Post-its or index cards and kind of move them around or put them on a wall to decide what makes sense and where's each category of content going to go. So at this point, we want to do yet another activity. This one is pretty fun. So imagine that you are setting up a website for a small neighborhood market so that people can put in orders online for curbside delivery. This is a very real scenario for a lot of small businesses recently. So how would you organize the shopping experience on the site so that people can easily navigate the store's inventory and find what they want? Here is your inventory. So here's the things that people would be able to purchase online or order online through this system. So again, I'm going to give you all a couple minutes to jot down the categories that you would use in this online shopping interface. And as you're doing this, I'd encourage you to think about how you would label each category. So, you know, like what term would you use that users would know what to expect when they go to that section. You can also feel free to use subcategories if you think that would be useful to users. So again, I'm going to give folks a minute or two, let's say, to start jotting down your ideas. As you pull together your responses, you can drop those into the Q&A. And we'll share some responses in a minute or two. All right, I'm seeing some really great answers come in. I'll just give you guys another 30 seconds or so to put in your final thoughts. Great. So I see some really great ideas here in our Q&A window. One person has suggested that you could organize the content similar to a supermarket aisle, which I love that idea because that's something that users are probably already familiar with. It's probably how they're already thinking of their grocery list. So they suggested a category for produce, fresh fruit, produce, fresh vegetables, baking ingredients, bathroom products, fresh breads, meats, and cheeses. I think that's a really great suggestion. Another person suggested having an A to Z listing that had cross connections to things you could look up in a couple different ways. So if somebody was looking for beans, you know, they could find it under bean or canned beans. depending on the language that they would be using. Couple people identified fruits and vegetables as a category that would encompass a lot of things. Dairy products, vegetables, baking products, detergents. Yeah, so really, really great on the fly kind of IA development that you all did. This is fantastic. And I kind of wish some of the online ordering tools that I've used in the last few months had used our knowledge for that setup. So, all right. So at this point, I'm going to pass it back to Kim, who's going to walk us through our third strategy.
Thanks, Emily. So our final strategy for today is practice inclusive design. And it's important to design digital products that work for everyone. Whether we're developing a website like we've been talking about today, or maybe it's a mobile app or another digital tool, as health communicators, we need to strive to create a positive experience for all users. And when you think about accessibility, you may picture users with physical disabilities like vision or hearing impairments, but building inclusive products can help a wide range of users. So maybe someone who has limited literacy skills or limited health literacy, like we were talking about today, or maybe they have cognitive impairments. Maybe they live in a rural area with limited broadband service, or maybe they don't have a computer and access the web on a smartphone. You know, many of us deal with challenges that make it harder to navigate and understand health information on the internet. And as Emily said in the beginning, we know that most of us are searching for health information online at one point or another, and we may be looking for information in response to a stressful situation. And some of these challenges, like low vision or cognitive disabilities, may be permanent, but there may be other temporary challenges that we're likely to face throughout our lives. For example, maybe you sprained your wrist and you have to type with one hand for a few weeks. You know, maybe you're staying up late, caring for an infant son or daughter, and that lack of sleep makes it hard for you to concentrate. This is the same with how we view health literacy. It's really context dependent. And disability is really the result of a mismatch between the product or technology and the user. And the same is true with limited health literacy. You can eliminate these challenges by designing products or information that work for your users. And by practicing inclusive design, you can make your website better for all users, not just those who may have disabilities or maybe they're on a slower internet connection. So you may be asking yourself, well, great, how do I do this? How do I make a website that's accessible for all? Well, the first step is to ensure that you're following federal guidelines for 508 compliance. So Section 508 of the Rehabilitation Act of 1973 states that all websites and digital tools created by federal agencies must be accessible to people with disabilities. And so even if you don't maintain a federal website or work for a federal agency, maintaining 508 compliance or meeting 508 compliance is really an industry best practice. There's a couple different tools that you can use to kind of check to see, where you can check to see how your digital product is doing. So, you know, you can look at Section 508 or Web Content Accessibility Guidelines, and they'll provide some checkpoints that anyone, like I was saying, can use to test their digital products and ensure their content is accessible to a wide range of users. And we really see this step of meeting 508 compliance as kind of a baseline. And there's more that we can do to make sure our website is really inclusive. I'm going to go over some of those strategies next. So, you know, as health communicators, we really do have the opportunity to go beyond 508 compliance. And there are a couple of different ways that we could do this. So the first two bullets here are really circling back to human-centered design. So understanding your user's needs first, conducting iterative user testing. So it's important to involve your users throughout the process and make adjustments as you go. I'll say that for the National Institute, Emily and I are actually in the middle of conducting a second round of user testing on the NEI's public site. So the work is never really done. And, you know, we also get talking about content, and Emily has been talking about content strategy, how to set up your site, how to organize your site. And so kind of following best practice, health literacy best practices, and writing in plain language, and the type of tone you use will really go a long way to ensure that your site is inclusive. Some other inclusive design best practices. So these couple bullets here kind of relate to how you're designing your website. So, you know, we know from health literacy best practices that limiting the amount of content that you have, you know, using that white space, keeping content in the center of the screen, ensuring a color contrast ratio of at least 4 to 5 to 1, making sure you're using a font that's easy to read, all play an important role in making sure your website is inclusive. And I've included here an image of different color contrast examples and the ratio in which you want to achieve, which is at least 4 to 5 to 1, which is at the bottom there. And there are some tools out there that can tell you if whether or not your color contrast is hitting this mark. All right, and some other best practices. So you want to consider how your design and content decisions impact users that may use assistive technologies like a screen reader, or someone who may be using some accessibility features like zooming to 200% or high contrast mode. You want to also ensure that your website is mobile friendly and that it can respond to different sizes. So whether your users on a desktop versus an iPad or a phone, it's responding and reorganizing itself nicely, depending on which size a user is looking at it from. You know, ensuring your website works for users on slower internet connections. And the last but not least is repeating for new features and content. So as I alluded to before, you know, the work is never done. So you want to continue to consider inclusive design best practices when you're adding new features to your site or new content. So these are, this type of thing is just never ending. It's always, it's hard to get it all right. There's a lot of different things that you can do, and it's hard to make something that's inclusive for everyone, but it's really understanding who your users are and building the best product for them is really what's key here. And these are just some strategies that you may implement. So, we talked about a lot today in these, you know, these last 40 minutes. So just to reiterate, we talked about how to identify and involve your users in your site redesign. We talked about goal setting and objective setting for your website. We talked about creating a content strategy that prioritizes health literacy. Got a little practice at developing an IA with at your local grocery store. And we talked about some tips for practicing inclusive design. And our last little activity before we open it up to Q&A, we would love to hear from you about maybe some key takeaways that you're going to apply to your website. So is there anything that we said here that you could take and maybe implement going forward? Anything that really stuck out to you? We'd love to hear. And at the same time, we can also open this up to Q&A as well. So we are here for the next 7 or so minutes to answer any other questions you may have as well.
When as folks are collecting their thoughts, I'll just share, I saw a couple questions in here about specific tools that we mentioned. A couple folks were asking about MindMeister, which was the tool I mentioned, the kind of mind mapping tool. We can share a link to that in the discussion area for this session after the session ends, so folks can check that out if they want. One person was asking if that's a free tool. I am 90% certain that there's a free version of it, and I think after you use it a certain number of times you have to get a paid version, but you can use it as a free user to some extent. And I think somebody also was asking about whether we could share the names of some tools that test color contrast, and I think we could share that in the discussion tab as well. So where shall we start, Kim?
Well, I was just thinking, I scrolled up to the top here to see what one of our first questions, and that was about the Venn diagram about the different element, or the human element, technology, and business, kind of meeting that sweet spot. And someone asked, with time and budget constraints, which methods provide greatest return if can only select one or two methods? And that's a great question. So I guess what I would say there, and Emily, feel free to jump in too, but I would definitely say that the empathize phase, so understanding, talking to your audience is super important. So maybe you could do a quick survey, depending on who they are. Maybe you could do a quick survey that won't take too much time or money. Maybe you do a focus group, so you get a lot of people in the room. Where time and money might increase is maybe doing those one-on-one interviews. So maybe trying to get more people in the room. I would also recommend doing some initial IA testing. So we had done something called click testing. And again, that can be done online. So you don't have to worry about getting a site and having to get people in the room and all that. So anything that can be done remote is pretty great. So in that way, you can get some initial thoughts on your IA. And so we had done that as well. And we had done some remote usability testing as well. So after we had built the site, and so that does reduce costs. So those are some options. Emily, do you have anything else that you wanted to mention for some time-saving, budget-saving measures there?
Yeah, I would add, so at Communicate Health, we're lucky that we have a whole research team. And so we do kind of formal usability studies and like research studies. But, obviously not every organization has access to those things. There are still some quick and easy ways to make sure you're getting that important feedback from users. So if you work for a healthcare center, for example, and you have a patient advisory group, can you go to that group and just ask for their input or kind of lead a discussion to see what tasks they want to complete when they go to your website, or have them test out, like Kim said, the prototype. So I would just encourage you to kind of think creatively if you're a small nonprofit or an organization that doesn't have these kinds of resources, that there might be some groups like a support group, a patient advisory group, et cetera, that you could tap into without feeling like you need to do a formal study and like recruit people and that kind of thing. So that's what I would add there. Great. Sorry, we're just scrolling through your many wonderful questions. Oh, go ahead, Kim.
I was gonna say there's a great question here about how to convince IT and website developer that health literacy on a website is important. Any advice on how to encourage the designer of the importance of human-centered design? They look to be they're in the process of redesigning website, and their designer is resistant to user experience testing and really just wants to use heat maps. A lot of different things to unpack there. And I think it just kind of reminds me of my experience with working with Emily and trying to get people on board with health literacy best practices in plain language. Some of it does require just taking a pause and doing that education. We've had to do some like client education where we had to pause and just be like, these are the reasons why, designing for someone with limited health literacy benefits all, and kind of pulling in that data. So getting people on board in the very beginning of the process is super helpful. And so how to encourage the importance of human-centered design? I really do think it, and again, we're lucky at CH because our leadership is pushing human-centered, not pushing, but like it's like all encompassing at CH. It's just part of the work that we do. So if you can get stakeholder buy-in in this process, I think that will really trickle down and really help you have the support that you need to make sure that these best practices are in place. I'll pause there and see if Emily, I know you've had a lot of experience with this too, but there's just a lot to unpack there. But I think that's a great question of how to get people on board.
Yeah, that is a great question. I mean, it sounds like in this example, maybe the designer has been resistant to doing user testing at all, but if you are able to like get some initial user testing done, I think hearing from actual users is so impactful that people who might think that there's no problem with our site, people can do what they need to do. If you can actually like get them in front of users who cannot figure out how to pay a bill or make an appointment or find information that's really important to get to them, that can really make a huge difference. And sometimes, if you even just got in like feedback outside of a usability study, you know, like if you've gotten an email from a patient, for example, that's like, I can't figure out how to find my appointment in this on the site or something like that. Those are some things you can use as well. Yeah. I'm seeing also, I'd like to kind of share some of the takeaways that people shared with us from the site, which are from this presentation, which is really exciting. A couple people have shared that their takeaway is that they really need a voice for their website and they need to make a conscious decision about what that voice is. And I'm also seeing a couple people committing to, you know, taking steps to make their website more inclusive, make it more mobile friendly, which is really wonderful.
Emily, we did get a question about voice and tone, and specifically about, does your voice and tone change depending on the various users that may be coming to your site? So, for example, someone said, how do you approach language for a website that has different targeting different users? So families, schools, healthcare providers. Should the voice and tone be consistent throughout, or is it appropriate to use different terminology / message complexity within different sections? I think that's a great question.
That's a great question, and definitely one that came up for the NEI website, because a lot of the content there is for consumers who are looking for information about their own eye health or the eye health of a loved one. But there's also, you know, researchers who might be using that site. So people who, you know, have a much different understanding of eye health and vision science. And so I would say that you still want a consistent voice. You know, you might still, like, if you decide that your voice should be welcoming and friendly, you would want to use that on all your content. But if some of the content is for a different audience, it makes sense to use language that that audience is familiar with. So on some of the pages we wrote for researchers, we were using different terms to describe like grants and funding opportunities than we would for a consumer audience, for example, because we knew we'd done the research with researchers. We'd done some research with eye health researchers, so we kind of knew what they were looking for and how they might be thinking of it. Yeah, so it's okay to use different terminology, but I would also just, you know, say that point again, that even your users with higher literacy skills, or a lot of that you think have a lot of information or knowledge about the topic that you're sharing about, they probably still appreciate a site that's easy to navigate and find what they need really quickly, and, you know, figure out what they're trying to do really fast. So it's not like you throw all these principles out the door if you're writing for a professional audience. Kind of a long-winded way of answering that. So, and I think we are probably just about at time to wrap up. I don't know if there's a last question that sticks out to you, Kim, or if we should just wrap it right up.
I think wrapping up sounds good. I know that there's also that discussion feature that we have available, so we could answer some more questions there. So if folks want to use that functionality, we could take this conversation over there. But yeah, there's so much to talk about, as you know. I mean, it's hard to do a web redesign in 50 minutes, but we just wanted to give you some quick strategies, and I hope you guys found it useful. Thank you so much for participating and making us feel that there are people in the room, and which is so nice. So thank you so much.
Yeah, thanks everybody.